Welcome back. March is Endometriosis Awareness Month, and experts like Fidelis Care Medical Director Dr. Thomas Raskauskas are making sure women take the proper steps to stay protected. He's joining us live this morning. Doctor, thanks for being here. We appreciate it.
Thanks for having me.
All right, so for those who have no idea, can you tell us a little bit about endometriosis and the dangers of it?
Well, endometriosis is when the lining of the uterus implants in areas other than the lining of the uterus. Normally, the lining sheds every month, and that's what causes a woman's period. When those cells go into the wall of the uterus or implant in the pelvis, it can cause severe scarring and infertility. The scarring can cause severe pain that's related to the menstrual cycle, and it also can cause pain during urination and with bowel movements if it adheres to the bladder or to the bowel.
So those are just a few symptoms that women should be on the lookout for, but is there anything else that might be, overlooked because it's just a normal symptom of everyday life or of, being a woman?
Well, that's a good question. And what I tell my patients is to keep a diary of when their periods and when the pain occurs. Usually you'll see this pain a day or two before the period, and it lasts usually through the entire period and maybe a day or two later. If it lasts the whole month, it's probably not endometriosis. But what happens is gradually the pain gets worse and symptoms worsen, and you can have worsening of the scarring. And that occurs in about 1 out of 10 women during the reproductive lifetime. It's also the most common cause of adolescents missing school and women missing work. So there's severe consequences if it's left untreated.
Wow. What is the treatment for that? I'm assuming that there's no cure?
The treatment starts out by using medications called nonsteroidals like ibuprofen. If you keep a diary of when the pain occurs, you want to start this about 12 to 24 hours before your period. And if that doesn't work, then you may be given birth control pills, either in combination with estrogen and progestin or progestin only. Some doctors prescribe what's called continuous birth control, where you have no periods to try to lessen the pain. After 3 to 6 months, if those symptoms aren't any better, your doctor may recommend minimally invasive surgery where a small incision is made in your belly button and the doctor looks into the pelvis and abdomen for any signs of endometriosis and scarring.
Okay. What should people do, women do, people do if they think that they have this disease?
Well, if you think you have endometriosis, the first thing to do is keep a pain diary and then make an appointment to see your doctor. If your doctor isn't listening or brushes aside some of your complaints, I encourage women to seek a second opinion because endometriosis worsens over time. And particularly if it starts in the younger years when you're in your 20s before you have children, it actually can make it more difficult to get pregnant and even cause infertility.
All right, doctor, thank you so much for joining us this morning. We appreciate it.
Thanks for having me.
All right, stick with us. Mike is tracking the forecast when we come back.